To the pandemic now, and an unexpected development brewing when it comes to vaccine mandates for some healthcare providers.
Exactly a month after notifying doctors, dentists, physiotherapists, and others they'd have until late March to get vaccinated, there are questions tonight about whether they'll actually be forced to.
The College of Physicians says right now GPs don't have to. And our Penny Daflos is here. And Penny, there are signs the government may be flip-flopping on expanding the vaccine mandate to all healthcare professionals.
Yeah, it sounds like one of either two things could be happening. Either the government still can't sort out how to require these medical professionals to be vaccinated 5 months after they said they would, or they could be backing down. So which is it? Well, late this afternoon, the government of Alberta announced it's dropping vaccine mandates for healthcare workers this week. So the question, will BC follow suit?
A small percentage of BC nurses, care aides, and paramedics have refused to be vaccinated against COVID-19 and lost their jobs. For months, the government has been warning other healthcare workers like doctors, dentists, physiotherapists, and pharmacists they'd face a similar vaccine mandate.
For several months now, we've been working with the health professional colleges to sort through the details.
And exactly a month ago, they were notified they'd need their first shot by March 24th.
It's a really important measure that brings the same standard to all healthcare workers across the province.
But now the order addressing those professionals only requires them to report their vaccination status.
This is a step required regardless of any other decisions that might be made.
That there are decisions still being made on a vaccine mandate with no details or potential consequences had the health minister exceptionally vague when pressed.
I wouldn't draw any conclusions about that. We're going to be updating on this issue and a number of other issues on Thursday.
The College of Physicians and Surgeons emphasized no, the order does not require vaccinations for its members to continue to practice medicine.
I don't know how they plan on enforcing any of this garbage.
A small number of unvaccinated professionals has been speaking out while others are urging patients to speak up.
I'm the one that's screwed.
As they warn they'll be left without GPs at a time they're already scarce if the mandate goes ahead.
I'm triple vaxxed. It should be up to me whether I want to go see her in person or not. And if I do want to go see her, then I should be able to accept all the risks.
Overall, about 97% of BC healthcare workers have protected themselves and their patients from serious illness with immunization. Henry calls the unvaccinated minority, quote, a health hazard under the Public Health Act.
Okay, so Penny, this order to gather information on vaccination status could have been made a while ago. We're quite late into the pandemic now, so why the delay?
I really wish I could answer that. Dr. Henry has said in the past that she doesn't want to be in the order business and was initially opposed to vaccine passports. It may be that they've been avoiding a complex issue in the hope that COVID would just go away. But the reality is the virus is still circulating, and high-risk patients could continue to face that risk from the very people they count on to care for them.
All right, thank you, Penny.